Crystal's just going to pull up some brief slides for me. That really was the bulk of our presentation, but I just wanted to touch on where we would go from here once we've identified it. So, like we said, like Crystal was saying, once we've found out what limb it is and what area it is, our next goal is to figure out what exactly is causing it so that we can figure out how we're going to treat it and get that horse better for you. So there's several techniques that we can use to see inside the horse's body, some of which are available on a day-to-day basis and many of you are probably familiar with, and others that are a little bit more high-tech and require specialized facilities and specialized equipment in order to get those done. I don't know if I know how to use her computer. I'm not an Mac person. Down button? Okay, there we go. So the first one, and probably the most commonplace and well-known type of imaging in use in horses, and most people with horses have probably seen these at some point in time, but these are your good old radiographs or x-rays. They are essentially a photographic image that's produced by shooting x-rays through the limb, from one side of the limb to a plate that we've got on the other side. These x-rays, which are a form of electromagnetic radiation, can penetrate right through soft tissue and skin and bone and, ligaments and muscles, but they can't shoot through bone. And so that's why the bone shows up in white on the x-rays. And that's definitely what we are most commonly looking at on radiographs. We're looking at the bony structure. We're looking for things like arthritis, fractures, sclerosis or remodeling of the bone, or developmental problems with the bone itself. Most practices are now using digital technology for this, which means that we can take the image and evaluate it almost instantaneously. This is opposed to years past where x-rays had to be shot onto the plates had to be taken back to the clinic or to a hospital and developed much like a photograph before you could actually look at it and get your response. So definitely the digital technology has advanced our ability to use this tool in practice quite dramatically and has given us a lot more sharper, clearer image of the bone. If we think it's something else that doesn't have anything to do with the bone, or if we've taken the x-rays and they're clean, there's nothing on them, then the next thing that we typically progress to, and I do apologize, those don't seem like they're showing up very well at all, but ultrasound is also pretty commonplace. Ultrasound gives us sort of a real-time view into the horse's body. It uses sound pressure waves. So the little probe, and again, I apologize for the quality of the images, but in both the upper right pictures, that gray structure that it's actually Alyssa holding onto, that probe or transducer is sending out sound waves into the tissue. These are much like the echolocation that's used by bats and dolphins and whales, as well as the sonar that's used by submarines, where it shoots it out and then it receives the echoes back. And as it receives those echoes back, it calculates how far it went and what type of tissue it went into, and then translates that into a black and white image on our screen so we can actually see those different types of tissues. And I'll use the one on the right because it is a little bit clearer, and again, my apologies, but this white line that you can kind of see down at the bottom, that's often what happens when we hit bone. It's a very, very white line structure. And the ultrasound waves can't go any further than that. So that's the last spot they'll get reflected back at us. But in between there and the skin, which is the very upper surface, we've got a tendon and a ligament in the way. So that's what we can see the best on the ultrasound, are those tendons and ligaments. We can look at the fiber structure and see if there's any tears or problems with where it's actually attaching to the bones. So between these two, we often get a pretty good picture of what we need and a pretty good answer. But sometimes these just don't do the trick. And the next, becoming more common, but definitely less common, would be magnetic resonance imaging. So this is an MRI. So those of you who are human athletes or no human athletes know that MRI is probably the gold standard for any sort of athletic injury. They may send you for an X-ray and they may send you for an ultrasound, but more often than not, you're going for an MRI. And the reason for that is because we can look at the bone and the soft tissue together and see how they're functioning at the same time. This type of technology is by far the best imaging for foot problems. Ultrasound beams, unfortunately, cannot penetrate through the hoof capsule. So if you've got a tendon or a soft tissue injury down in the foot, there's no real other way to see it. The x-ray, if you don't see anything on it, doesn't necessarily mean there's nothing wrong down there. It just means that we need to find another way to see it. So magnetic resonance imaging uses well, you can see it's a giant magnet. That's what the white thing is that the horse has got its feet stuck into. It uses a really powerful magnetic field instead of radiation to create these sliced images of the foot. And again, like I said, it allows us to look at both the bony and the soft tissue structures at the same time and get that full picture. It also allows us to look at slices of the leg at a time, so smaller areas, rather than an X-ray where you're looking all the way through a 3D structure at a 2D image. It gives you a lot of tissues and structures that are on top of each other and makes it a little more difficult to pick things apart. So. But unfortunately, because of the cost of that bloody magnet, these are only available at fairly specialty facilities. Right now there's one at WCVM in Saskatoon, and one in Washington State in Pullman, and one out on the coast at the Vancouver area. So they're a little harder to get, but definitely the answers that you can get with those, if we aren't able to get anything with the X-rays and the ultrasound, are invaluable sometimes. The next thing that really isn't commonly used for lameness per se, I mean, in fancy places where they can throw anything in a CT, they'll probably put their lameness cases in it, but in clinical practice, we tend to send things with head issues or sinus issues or things like that for a CT where there's no other way to image it. CT, I'd say, is pretty uncommon at this point in time in lameness, but it's another thing that we can add and that can add another picture to it. It essentially it looks similar to the MRI, but that big ring that you're looking at on the picture on the left is the gantry that is shooting X-ray beams as a rotating focus beam. And again, it takes a slice rather than trying to put a 3D image onto a 2D picture. And so you can see each little area individually. So the picture on the right is showing a fracture of one of the little bones in the knee that on the X-ray wasn't visible because there were so many other bones and soft tissue and stuff in the way. So when they got that one little slice of the leg in that CT view, they could see that little fracture. So again, these are only available at certain facilities. It's really not very commonly used. And then the last one that I'll just touch on real quick here before we wrap up would be nuclear scintigraphy or bone scans. These are relatively commonly used, and mostly because they're a good screening tool for mystery lamenesses or cases of poor performance or things that you just can't quite explain what's going on or can't see something definitive. And the reason that it's a good screening tool is you can put the whole horse in there and scan the whole thing at once and kind of give you an idea of where something might be going on. So the way that this is performed is the horse is injected with a radioactive isotope, which is technetium-99. Sounds really funky, but this is put into the bloodstream, and the dye actually moves throughout the body and is absorbed into areas where there's increased metabolic activity. So where things are remodeling or there's inflammation or things like that, that dye will localize there. And then they use a gamma camera, which is a camera on a robotic arm, to go around and scan the horse and take multiple images. And it picks up these areas of increased radiation and puts them onto a computer screen so that we can see them. So the arrows in those pictures are, again, I apologize, it's not very clear, but they're showing areas where there's increased dye uptake, so it tells you that there's something going on there. So these, again, can look at bone and soft tissues, but they're more good for telling you where the problem may be, but not very good at telling you what the problem is. Usually you have to follow a bone scan up with some other sort of imaging to figure out exactly what it was that was causing it. But again, we use these often in cases where you just can't quite figure out what's going on. They're just not working properly, and it can give you a few more indications of where to look further. So that's pretty much all we've got for you. I'll open it up to questions again once more if anybody else thought of anything along the way, but in terms of the lameness exam, how it works, how the sensors work, anything like that, if there's any other questions. Oh, we did a good job then. One more thing.
I was going to say too, there's little handouts on the table over there, so if you didn't get one, make sure you grab one on your way out. It just has a little bit more information. And I'll post these slides on the website too, so if you guys feel the need to go back and take a look, they'll be up on the website in a little bit here.
I have a planted question that we get quite often.
Wow.
Does it work on dated horses?
I should turn this back over to Crystal, but I believe it works reasonably well in horses that pace, correct? So pacing is a symmetrical gait like trotting is, so it will work in pacers. We just have to flip the data that we get because they're moving with both legs at the same time. Horses that it doesn't work very well in are horses with gaits outside of that realm that aren't 2-beat gaits. So it doesn't work very well on Peruvian pesos and walkers sometimes. Unfortunately, I imagine that they're going to work towards that because there's a ton of Tennessee walkers down in Missouri where Dr. Keegan is, who developed this machine, and it probably drives him crazy not to be able to use it on all those walkers. So I imagine they're working on it, but at this point in time, it does need to be a symmetrically gated horse. So. And we haven't yet tried it on a mini either, but we like to try it.
But he doesn't like boots, so.
Doesn't work on humans, yeah. I don't know, we should try it. Alrighty. Okay, yeah, so feel free to pick up a hand up on your way out, another juice box, water, anything, snap on your way out, and to showcase it or try it? Well, you know, we purchased this unit in December, and luckily us veterinarians own a fair number of lame horses, so we have been able to use it on quite a few of our own horses. And you know, we're pretty confident with its ability and how it's working now and how we're gaining data. So, you know, we don't necessarily need that many more cases, but we're more than happy to put it on them and have a look at them and see what's going on. Yeah, it's a great baseline tool. It's a great screening tool. It's going to give you a lot of information that otherwise you wouldn't know. Yeah?
So if I bring a horse in for a lameness exam, do I choose whether I want just the traditional lameness or I want this device used, and what is the posture?
Okay, so her question was that if she brings a horse in for a lameness exam, can she choose between a conventional lameness exam and having the inertial motion sensors on? And what was the cost of it? Is that what you said? So at this point in time, we feel that this technology has given us so much information that we would really, you know, we want to put it on every lameness case. And now we know that sometimes we'll be out at a barn, asked to look at a lame horse, and we may not have it with us. So in that case, we'll still do a conventional lameness exam and see what we find. But that case in point that Crystal showed, the case number 2, where you watch that horse go and you think, gosh, that's a left front lameness. Everybody thinks that's a left front lameness, but lo and behold, you put the lameness locator on and it's actually coming from the hind end. So those cases are ones where you could block that horse all day, you could work it up all day long and be looking at the wrong leg because you should have been looking at the hind end. So for that reason, we feel that we want to put it on everything so that we get a pretty accurate picture of what's going on and whether or not they've got one leg involved, 2 legs involved, all 4 legs involved, you know, so we can get a pretty accurate picture. So at this point in time, if you book a lameness, we're going to have this with us. The cost of it, we have our conventional lameness exam usually ran about $120, I think, and we've priced this at $200. So it is a little bit more, but it's some pretty valuable information. So if you're absolutely opposed to having the sensors, we can do a conventional lameness as well. It doesn't hurt our feelings any, but I think you'll be amazed at the information it gives you. So yeah, there was one more question here too, was there?
Just wondering if those is done. How many times do you think or how often should you just lay a baseline for your horse? Like, would you start off with a baseline to see what their normal gait is and how their
Sure.
structure and build, and then it may show up on here that looks like lameness, but the horse isn't having any pain.
Sure.
Or you're not finding with the traditional methods that it's really causing them. Does it really matter if that's the way that horse is, or that's just how they are? If you don't have a baseline to know over here over 2
Yep, that's a good question. So her question was, if you were to bring a horse in on a screening basis, just to get this done and see where they're at on a baseline level, how often should you do it? And if you found something on that horse that wasn't having any problems, that seemed perfectly sound and didn't have any complaints, you know, what would you do about it at that point in time, essentially, right? That's what you're asking. So I would say that on a screening basis or on kind of a maintenance basis, just to watch how they're moving, annually would probably be reasonable, depending on their work level as well. I mean, some of the horses that start young and start into training quite young and increase their training quite rigorously. So, you know, reiners and cutters and those horses that have to work pretty hard at a young age, you might want to do it a little more frequently, twice a year, something like that, as they increase their training level. But for most horses, annually is probably sufficient. If we were to find something on it, then we do have a conversation about, whether you are concerned about at this point in time, what things you might watch for to indicate that it might be a problem, and gives you a baseline, like you said, so that you can monitor it over time. If you have a very, very subtle abnormality and it doesn't seem clinical, they've had no problems, and we have come across that where it's a very, very, very subtle front limb lameness or something like that, then we say, well, at least we know what it's at now. You can ride them, see if you notice any, changes in how they're jumping or how they're performing or whatnot. And if you start to feel that it's bugging them, we run it again, see if it's gotten worse or if we just need to pursue it at that point in time. So, did that answer your question? Okay. Yeah. Mm-hmm.
Are you using this to help the new owner assess the potential?
So she asked if we were using this for essentially on a pre-purchase basis. At this point in time, we haven't made it part of our routine pre-purchase exams. It's something that if requested, we can definitely put it on there. But at this point in time, when we spoke with the company about it, there was about 50% of practices that will put it on every pre-purchase and 50% that wouldn't. And we just felt that at this point in time, we probably wouldn't unless asked. But that may change as we get, more familiar with it and have it around a little bit longer. We may change our minds on that. So. We haven't had a draft on it yet, have we? I haven't had it on a draft. Yeah.